As a doctor, you're going to run into a lot of different cases that you remember for years to come. And in my last 5 years of being a physician, this was definitely a moment of mine that I actually just finished up concluding taking care of for a patient and their family member in terms of a case that I feel like this is going to be another one that's going to stick with me for some time now, not only because it had a lot of great learning in terms of the actual specific medical case, but for me, being a palliative care doctor, we don't only think about the medical side of things, we think about the patient as a whole person, physically, emotionally, spiritually, psychologically. And all of those things really came to the forefront for this case that I was dealing with. To give you guys a little bit of context, this was a case of a patient that came in after a lot of different complications, had a choking episode, ended up having to go for a small procedure that was marketed as like, it's not going to be a big issue. We're just going to look in there with the endoscopy scope and try to pull the food out that you choked on. But this, what was supposed to be a couple of minute procedure, turned into almost an hour, and they had a huge complication, had to get transferred to other hospitals and even get transferred again to another hospital to come to our hospital. And that's when I actually ran into this patient and their family member. Now, the way that this case was presented to me was a lot of information about, like this patient went through all this, but the family is very difficult and the family is combative, or the family is, not really cooperating a lot, or this patient is a fiery family member. And, whenever I see language like that, I get intrigued because oftentimes for a medical society or a medical team or a medical group to give that sign out to another doctor, it must have been something that was quite impressive to make the impact, to make this other physician to want to share this to just as a heads up, this patient's family member is like X, Y, and Z. And oftentimes, at least for me, if I run into patients or their family members that have that type of dynamic with the healthcare society, I don't really pass that on unless it is something pretty significant and I feel like will affect the relationship between them and the healthcare team. So me hearing all this, I wasn't trying to move into any sort of first interaction in trying to have that in mind to bias me to act a certain way, because I feel like if you hear like a person is defensive or fiery or animated, you kind of can go in there with that bias and start going in with a defensive mindset, which you want to interact with patients and their family members as a fresh person, because you are a new person. The relationship that you're going to have with them is not going to be the same. Everybody interacts differently. And that's something that I take with me into every different dynamic. So me meeting this patient, I walk into the room, I see he's delirious, and I met the patient's family member. And I was able to not only build a relationship with his family member, but the biggest thing that allowed me to be able to connect very deeply with this patient's family member is I didn't go in there with this predetermined notion of how she was. I actually went in there as a fresh perspective, wanting to understand not only who this patient is as a patient, but also as a person. What makes this person this person? What do they enjoy? What are things that they like? What are some things that they've been dealing with for the last couple of years? Where are they from? Are they married? Do they have children, grandchildren? Do they have pets? Are they religious, spiritual? These are all questions that I ask, especially as a palliative care doctor where I'm treating the whole person. These are all things that I ask to try to understand who this person is, because this is something that I feel like is lost a lot, but a lot of physicians, and I don't really blame them, because oftentimes with the healthcare society, you're pushed to see as many patients as you can, to be as efficient as possible, and just boom, 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 move really quickly. And it's not very patient-centered, but it's a very lost art to be able to connect with the patient, understand who they are as a person. Because for me, I don't feel like you can really treat a patient unless you understand them, how they deal with things. Trying to enforce like a one-size-fits-all approach across all different patient demographics is a recipe for failure. I was going to say a recipe for success, but it's actually a recipe for failure. And you trying to impose a will like that on different patients of like, we're going to do things this way, and you don't have a way to say against it. And it's a very paternalistic way of medicine that we're trying to really veer away from because one, there's a lot of mistrust in the healthcare society. Two, just being admitted and coming into the hospital, it's a really huge blow to a person's not only dignity, but also their autonomy and their their sense of independence. And that is already a place putting them on the disadvantage. And a lot of times patients don't feel like they can speak up for themselves. And for this patient was delirious, so he couldn't really speak up for himself anyways. But this patient had a family member that was there. And having a family is such a luxury, especially for people that are sick that are coming into the hospital, because you are coming in as a provider, as a fresh person, not knowing who this person is, what they've been through, what kind of medical treatments that they've had and how they responded to it, their feelings around it. And you don't understand all those things. You're going in. So you need to be able to humble yourself to learn from the people that know this person the best. And thankfully, I had this patient's family member that was such a huge advocate. And although she was presented as a fiery, combative, whatever, I didn't use that and stigmatize my feelings of what it's been kind of built up in the past to affect my relationship with her. And once you're able to understand a person and who they are, other people can pick up on that. Other people can see that. And I felt that she was able to see that I was trying to understand who this person was as a person, not just a patient, not just another number. And oftentimes patients can feel that way, that I just feel like I'm another number to this patient. I'm just a heart failure patient. I'm just a cancer patient. I'm not X, Y, and Z. I'm not Adam. I'm not Jake. I'm not Nancy. I'm not whoever. And it can feel pretty deflating to feel like a number. And I've been a patient once in my life, and it wasn't the greatest experience. And it wasn't even really for a huge medical issue. And to imagine someone coming in older, sicker, multiple medical problems, they're already not feeling great, and then to have a person come in there and try to carte blanche, try to treat you in a specific way, it's really unfair. And I feel that the biggest thing that you need to recognize about patients that are pre-labeled as difficult or non-compliant, a lot of these buzzwords that we make you start feeling a certain type of way even before meeting them, that also goes to patients' family members as well. And you want to really understand, what is this patient's family member's motive? And a majority of the time, the motive is that they just want to get their family back to be better again. And I think me coming to this patient's family member's perspective of, hey, like, I want to meet you where you're at. I want you to understand that I'm trying to come and treat this family member of yours in a specific way that is aligning with what his goals would be, with what his ideal quality of life would be. And I want to understand from you, how can I get to that goal? These are the medical treatments that are available. These are the medical treatments that are something that we can offer. But what do you think that your loved one wants? And what type of care do you feel like your loved one wants? Because we can't successfully get this person back to being better again if we are not taking your input and not taking your perspective. And can we set up a medical plan that is even feasible for after you leave the hospital? Because we can do whatever we want in the hospital to try to achieve an ideal way of this person getting better. But is this something that's sustainable? Or are we just putting a Band-Aid over this until they go home and get worse again? And you want to understand a lot of the things after the fact. And I learned that this patient and their family member are not very well supported. They have family, but those family members aren't involved. And these are all important qualities, because when this person leaves, are we just going to send them home? They're just going to decompensate, get worse, and then just come right back to the hospital? What did we even really do there? What did we even really achieve? It's something that I often found myself kind of falling into, of like, okay, we just need to get them better in the hospital and then they can go home. That's just part of the battle. Not even half the battle. The other half of the battle is, how do we treat this person to get better, and then treat this person to get better and stay out of the hospital so they don't have to keep on getting back? Because coming to the hospital is not a benign thing. It's not an easy thing. It takes a lot out of people. And oftentimes people can get a lot more complications being in the hospital than even being out of the hospital. So my ideal way that I try to approach patients, treat patients, how I try to deal with these situations is understand the patient, who they are, understand the patient's family members and their role, and also recognize that you should be seeing your patient's family members as advocates. They are the most strongest advocates for your patients. If they were there, imagine a patient that's delirious, can't advocate for themselves, can't speak for themselves, can't express their desires and wishes. That patient is at a disadvantage. So having a family member there, however they are, whether they're difficult or not compliant or not listening to what you're saying or giving you pushback, because I feel like a lot of providers feel that pushback is always a negative thing, but I always see pushback as a positive thing in a healthier way, because if a person and their family member are not giving some sort of pushback, it doesn't have to be like a very negative type of pushback. It could be pushback for understanding, like, hey, I don't really understanding what you're saying in this aspect. Why are we doing things in that way? And understanding how a patient and their family member can take in information. This patient's family member was very visual, so explaining the procedures verbally wasn't enough. So I brought up a video, I brought up pictures, like this is what this procedure looks like, this is what this instrument looks like. These are all things that you should be expecting, trying to set them up for success so they know what they're getting themselves into. We can talk and talk and talk all we want as providers, but if we're not showing our patients what they're going to be getting, telling them the risks, the benefits, the intended side effects, the things that we expect to see in the future, these are all things that family members are trying to understand, and doctors are trying to fix things a lot in the moment. And sometimes they don't have the forethought to think a little bit farther ahead because they're so pigeonholed in that actual, moment right there. And I feel that's more of like an early trainee thing. So I'm glad that I'm at an institution that has a lot of trainees where I can give them these frameworks of thinking. And it's something that we do need to get better, because years and years and years and years and years in practice, you can oftentimes get to that point where you might start feeling like you're burning out and you're starting to treat patients as just another number or just another diagnosis, like, oh, I have a heart failure patient, I have a COPD patient, I have a cancer patient, I have so X, Y, and Z, instead of like, I have Nancy, Drake, whoever, and treating them as a person and a human being that has a whole life, has loved ones, has advocates there that want them to get better. So we all want our patients to get better. I want my patients to get better. I want to do it in a way that is patient-centered and not just, oh, I'm the doctor, whatever I say goes, because if I try to take that approach, it's not going to end up in the way that I think it's going to end up. So I just wanted to share that story because the interaction and the goodbye that I had for this patient's family member and being able to connect, not only just like from a medical side piece, and because I am from a Christian faith, so I was able to connect in that aspect as well, and realizing that patients need something to get through things, and it's your patient's spirit and their will, not only just their physical body, that will help them get past a lot of their medical issues or even cope with their medical issues. So recognizing that this person's faith is important, so consulting a chaplain to start by. If I had the time, I would actually do prayers with the patient and their family members, and really doing things and showing that, yes, I'm your doctor, but I'm also a human being, and I see you, I hear you, and I understand you. And I want to connect with you in a way that will make you feel trustful of the medical society, because a lot of people have lost faith in the medical society and the hospitals and the care that they get. And it's something that I find to be very sad, because the intent of healthcare is to get people better in an ideal world. But oftentimes that can get overseen by a lot of different external competing factors. But it's a lot of things that I think about, and it was a very happy experience that I had, and giving my goodbyes and getting the expressions of gratitude of this patient's family member. It was quite touching, and I'm glad that I was actually involved in this case. And this just continues to fill my cup, and seeing that a family member has trust in the medical society, that they're happy with the plan and feeling like they are a part of the medical plan. That is the thing that I want you guys to see, is like, you have to make your patients and their family members feel like they are part of the plan, like they have a say-so. Make them feel like you have a plan and that you're concrete in what you're saying. Because if you don't, if you're going there, you're not very clear with them, you're not making them feel involved, then they're not going to follow the plan, especially if they don't understand it. So these are all things that are very important. These are all things that I find to be quite interesting. And although this is something that we oftentimes forget as providers, it's something that is quite important. So I just wanted to share that with you guys today.